Histiocytoma is a harmless skin growth that is most often seen in young dogs, especially small breeds. It looks like a small round bump that sits on the skin's surface and feels firm to the touch. The word comes from histo, meaning tissue, and cytoma, meaning cell tumor, but the growth is not cancerous and usually disappears on its own. Imagine a tiny pink mushroom popping up on a puppy's back. That is often a histiocytoma. Explanation: the exact trigger for a histiocytoma is still a mystery, so we call it idiopathic. Scientists think it starts from a type of immune cell called a Langerhans cell that multiplies a bit too much in the skin. Possible contributors include minor skin injuries, allergies, or a genetic tendency in certain breeds. It is like a garden weed that sprouts when the soil is a little disturbed, but we do not know the exact seed. Typical signs are 1 or several raised, dome-shaped nodules, usually 0.5 to 2 centimeters across. The bump may be pink, red, or skin-colored, and often has a smooth surface. It feels firm but not painful. The dog usually keeps licking or scratching it. The nodule can grow quickly over a few days, then often shrinks and falls off within weeks to months. Think of a small ball that appears on a dog's ear, grows a bit, and then vanishes like a soap bubble. If the bump bleeds, ulcerates, or the dog shows signs of illness, it might be something else and needs a vet's look. A veterinarian will first feel the bump and look at its size and color. The most reliable way to confirm a histiocytoma is a fine needle aspirate. A tiny needle pulls a few cells for microscope inspection. The cells have a characteristic bean-shaped nucleus that tells the vet it's a histiocytoma. In doubtful cases, a small skin biopsy may be taken. Because the growth is benign, treatment is often just observation. If the bump is large, infected, or on a spot that hurts the dog, the vet may remove it surgically, freeze it with liquid nitrogen, or use a laser. Follow-up checks every few weeks help ensure it disappears as expected. There is no guaranteed way to stop histiocytomas, but you can lower the chances of skin irritation that might spark them. Keep your pet's coat clean and brushed, avoid harsh chemicals or frequent hot baths, and protect them from scrapes and insect bites. Regular veterinary exams let the vet spot any new bumps early. Think of it like checking your car's tires regularly. You may not prevent a puncture, but you'll notice it before it becomes a big problem. New research is looking at the exact immune pathways that cause the Langerhans cells to multiply, hoping to find markers that separate histiocytomas from malignant tumors more quickly. Recent advances include using immunohistochemistry stains like CD1 and S100 that light up the specific cells under a microscope. Small case series have reported successful use of low-power laser therapy to speed up regression, and scientists are studying why some histiocytomas resolve